Hi, my name is Brooke. I've worked in healthcare for 20 years at 4 different local hospitals. For the last 10 years, I've worked in mental health as a crisis social worker and psychotherapist. While social problems have been ever present throughout my time as a clinician, there has been an increase in mental health concerns due to the challenges everyday working people are facing related to affordability. Each week, including this morning, I hear from patients who are going without food, who are working 12 hours a day, 5 days a week, but cannot afford their rent, or who spend most of their income on childcare. These patients are highly stressed, have worsening anxiety, depression, and other health concerns. As a mental health professional, my goal is to help others in alleviating their suffering, to improve their lives, and to avoid tragic outcomes like suicide or overdose. But now, the typical psychiatric tools are not enough. We cannot therapize or medicate our way out of an affordability crisis. Additionally, my healthcare colleagues are exhausted and facing burnout and moral injury, both from trying to help patients in systems that have stopped caring about them and from their own difficulties, paying for rent, buying a home, affording their own health insurance, and suffering from chronically low wages. Many of the healthcare workers, young adults, my neighbors, and more either do not have health insurance anymore or do not qualify for employer-based health insurance plans. They are often going without health insurance, given the incredibly high cost, or working second or third jobs to obtain this basic need. I'll add, including myself in there. Affordable Rhode Island recognizes this issue. We need access to affordable health insurance, and we need it now. Through Affordable RI, we're asking that healthcare workers be paid salaries that not only compensate for our expertise and the importance of our work, but also afford the basic expenses that you heard Jesse talk about that make life manageable and less stressful. To improve our health and mental health, we need to improve systemic issues like wages, childcare, and housing. The solutions are clear and simple. Higher wages so that healthcare workers can afford to have their basic needs met for their families, and access to affordable health insurance for all Rhode Islanders. Thank you.
And how are we supposed to set our state up for the future and succeed in this environment? What it's all about. This project, this organization is about bringing these stories to light, to be part of the conversation and holding people accountable to that conversation. Thank you. I know it's hard. Next up is Love.